Good evening, everybody. My name is Jenny Pearson. I'm the Professional Development Officer at the Primary Health Network. Thank you for all coming tonight to our Quality Improvement Community of Practice. And tonight the topic is immunisation. Just before we start, I'd like to acknowledge the traditional custodians on the land that we all meet upon tonight and pay respect to elders past, present and emerging. Just noting before we start that we have a quality improvement community of practice at the Primary Health Network. This forum holds lots of information to assist you with quality improvement processes in your practice, including clinical toolkits on how to implement QI, one-pagers, examples of models of improvement with completed PDSA cycles, a chat thread and loads more. If you would like to access this, please contact the PHN by email or phone, and you'll be given information on how you can apply for access to the resources and the discussions. Please also regularly refer to health pathways, which are always kept up to date and are constantly improved and added to. The pathways are an amazing resource, and there are many excellent pathways available to help you on your immunisation processes. Our presenters tonight is our favourite, Patrick Cashman from the Public Health Unit, and John Bailey and Casey Wisemantle from the PHN. They will provide an overview of current immunisation processes for both the influenza vaccine and COVID-19 vaccines. In terms of asking questions tonight, please type these into the chat box on your control panel as we go, and John will ask these at the end of the presentation. And just a reminder, if you can all have your microphone on mute. There'll be a survey pop up at the end, so if you could all please fill it in just before you log off. Okay, I'll hand over to you, Patrick.
Thanks, Jenny. Can you see that now, Jenny?
Yes, that's great.
Great, thank you. Well, hello, everyone. Thank you very much for joining in. Everyone's life is very busy. I really appreciate your time. That's very good of you. I'm going to talk about influenza vaccines. Who would have thought we'd be talking about influenza vaccines in the midst of a pandemic? So we've all been focusing on COVID vaccines and how to get COVID vaccines ourselves and for our staff, but tonight I'm going to quickly run through this year's influenza vaccines. So the main thing is, where do you find information? I mean, a lot of you have got photographic memories and you'll hang on every word that I say and you won't need to access information, but for the rest of you, where do you find information? So on the left-hand side of the screen is the New South Wales Health website, and this is the immunisation page. So if you search for New South Wales Health immunisation, you'll find this. And this has got lots and lots of terrific information, including in the top left under alerts, the 2021 flu information for providers. And if you go there, there's a whole page on influenza information, and a lot of it's programmatic stuff, including a link to the toolkit, which is on the right-hand side of the screen. And the toolkit is fantastic for you people that are process orientated. It starts with a timeline of when to order vaccines and how to order the vaccines. And then it gives you a lot of really good practice tips on how to find people who need influenza vaccines in your practice software, how to recall them and when you should be doing that. It's really, really worth a read, especially if you're very organized. It will even help you be even more organized. Can't recommend it highly enough. It's put together by people that really understand practice and providing influenza vaccines. So one of the different things this year is when you receive your order of influenza vaccine, you've got to log into the online ordering website and let them know that you've received those vaccines, or you won't be able to order the next lot. And you're looking to order about a month's worth at a time. On that website, on the New South Wales Health website, there's some great promotional posters, including the one on the left for children from 6 months to under 5 years of age. Now, this is really important. So these vaccines, influenza vaccines for small children, are free in New South Wales. So from 6 months to under 5, those vaccines are free. And on the right-hand side, a really good influenza vaccination poster for Aboriginal and Torres Strait Islander people. When you're working with Aboriginal and Torres Strait Islander people, they often got a lot of questions, and that's the way the poster's framed. Common questions. So do take time when you're working with Aboriginal and Torres Strait Islander people to answer questions. Now, the names of the vaccines are always tricky. So on the right-hand side is a schema of the influenza vaccine. And we're used to seeing the corona vaccine with all the spikes these days. We're all experts on that. But the influenza vaccine also has little projections on the outside of the virus, not influenza vaccine, the influenza virus, little projections. And they're called neuraminidase and hemagglutinin. And there's 18 different sorts of hemagglutinin and 11 different sorts of neuraminidase. And that can give over 190 different possibilities, of which are about 130 are found in nature. So that under the orange banner on the left-hand side is the names of the quadrivalent influenza vaccines we have this year have 4 different serotypes in them, 2 A's on the left-hand side there and 2 B's. And the naming nomenclature is on the lower left there. So you can see the types in the grey box, influenza A and influenza B. And you can see for influenza A, we have subtypes, and that's A H1N1, for example, or A H3N2. And you can see that's what we've got at the top left, A H1N1. And the pandemic 09 is specifically that strain. Subtype to distinguish it from other H1N1s. But you can see in influenza B, we don't use subtypes, we use lineages. And you can see that again in the orange box on the top left is the lineage Washington and Phuket. And then there's the clades. So this information comes from the CDC, and the link's there if you want to have a look. So on the top left, we can see how we're naming them, A, Sydney, and the strain number, the year, and the virus subtype. And then on the top right is these are the ones that we've got this year. So it's an A Victoria, H1N1 pandemic 9, an A Hong Kong, H3N2, and then the B's are a Washington and a Phuket. So that doesn't mean much, but what it does mean is these things change every year, and the way the virus is circulated around the world is predicted, and then the correct strains of influenza, or hopefully the correct strains of influenza, are put into this year's vaccine so that we can protect ourselves from the circulating influenza this year. Now, why are we vaccinating with influenza? We're not seeing a lot of influenza at the moment. Well, there's not many blessings with COVID, but one thing is that it doesn't seem to affect children too much. It's mainly a disease that's affecting older people, which is it's no good if you're older, but at least it's sparing of children, which is diseases. We've all nursed sick kids. Diseases that are terrible with kids are just awful. But influenza is a disease that's terrible with kids. So just a reminder, this is CDC data. The 2019 season, so just the season prior to the pandemic, was a terrible, terrible season. And in America, they had 188 pediatric flu deaths. So those dot points there, 81 of those deaths occurred in children under 5. So that's the reason that influenza vaccines funded in New South Wales for children under 5, between 6 months and 5 years of age. Now, 12 of those deaths in America in 2019 season occurred in kids under 6 months of age, but those kids are too young to get a flu vaccine. And that's why immunizing the siblings of little babies is really important, so there's less circulating influenza. And then 107 of those deaths occurred in kids 5 to 17 years of age. Now, some of those kids had pre-existing conditions, but a lot of them didn't. A lot of them were healthy kids, and nearly 2/3 of the deaths were attributed to influenza B, which is why we use the quadrivalent, which has 2 B's in it, rather than the trivalent that we used to use. And it's the same story in Australia. This is an article from an RACGP publication, News GP. The same year, where we were just talking about 2019, 250 deaths in Australia, including children, including a 13-year-old Victorian schoolgirl and a 2-year-old boy from Western Australia. The article goes on to outline them, and this is the poor little lass from Victoria. Previously well, she wanted to play in the AFLW, very healthy kid, but died suddenly of influenza infection in 2019. And this is why we're offering the vaccine. This is why it's really important when people come into your practice, you offer the vaccine. Now, happily, because of the way we're living these days with social distancing, hand washing, gelling, we're not seeing as much influenza around as usual. So this is the flu tracking data. There's about 50,000 people participate in this every week. I'm sure a lot of you do. If not, search for flu tracking and join up. You just get a little email every Monday and it just says, have you had a cough? Have you had a cold this week? And this is the data. So you can see there the 5-year average is quite high. And last year, 2020, started off quite high, and then the pandemic hit early in the year, and then the social distancing, the lockdowns, the hand washing started, and then there was much less circulating influenza. Now, 2021, you can see this data is up to Anzac Day, just 2 days ago, and you can see that it's a little bit higher than it was this time last year, but still much, much lower than the 5-year average. And it's just a reminder that all those health things that doctors and nurses teach patients about washing your hands, you know, not touching your face, not sharing germs, all that stuff we teach kids that we try to practice in our own practice at work is really, really important for stopping all sorts of diseases, including COVID and influenza. And even when later in the year, when we've got COVID vaccine given to more of the population and we start to see the borders open up, that hand washing, the gel is going to be really, really important. Those practices that we've got now, we've got to keep them up. So the eligibility for the free vaccine in Australia is all Aboriginal and Torres Strait Islander people over 6 months. Remembering we don't give this vaccine to anyone under 6 months. In New South Wales, all children less than from 6 months to 5 years, and then everyone over 5 years of age with a medical condition, including cardiac disease, chronic respiratory disease, other chronic illnesses, neurological conditions, HIV, and impaired immunity, and kids on long-term aspirin therapy, as well as all pregnant women given at any stage in the pregnancy. So if a woman had an influenza vaccine early in the pregnancy at the end of last year, you can give this year's influenza vaccine to her if she wants it at the early part of this year in the latter part of her pregnancy. And all people over 65 are funded to have influenza vaccine. So which vaccines are we using? So this is the ATAGI schema. So this outlines all the vaccines on the market. It's a bit hard to tell, but some of these boxes are shaded and the shaded boxes are funded. So the VaxiGrip Tetra and the Fluarix Tetra is funded for small children and all ages. Now there's other vaccines on the market. Flu Quadri and Influvac Tetra are on the market, but they're not funded for anyone. So they're the sort of vaccines you'll buy in for people who aren't eligible for a funded one, or they're the sort of vaccines that the pharmacists, the retail pharmacists might have. Now the Alfuria Quad is funded for people over 5 years of age. Now this used to be called Fluvax back in 2010, and that's why we don't give this vaccine to anyone under 5 years of age. So that's really, really important. If you've got this in your fridge as a funded vaccine for adults, people over 5 years of age, it's really important that we don't give that vaccine to anyone under 5 years of age. And the Flucivax Quad is a new vaccine on the market this year. Now all the other vaccines are grown in chicken eggs. So the virus particles are put into the chicken eggs, they grow, they're harvested, they're attenuated, and they're given in the syringe to people. But the Flucivax is in mammalian cells, so eggs aren't involved at all. So this is a new vaccine. Now that's not funded at all, it's only available privately. but that's something you may want to consider for yourself. Does it work better than the other ones? There's some data to say maybe marginally it does. Now, people with anaphylaxis to eggs can safely have any of these vaccines in your practice, but if you had someone who's particularly nervous, they might want to steer away from eggs completely, and maybe that is a vaccine that you could steer them to. Now, the FluAd Quad, this is really important. So this is the only vaccine that is free and funded for people over 65. Now, the FluAd, now this has got the special adjuvant in it that is going to make it work much, much better in older people whose immune systems aren't quite as responsive as younger people's immune systems. So this is a really important vaccine, but really important, we don't give it to anyone under 65. You can see all the crosses there. It's not licensed in Australia for anyone under 65, but it is free and funded for everyone over 65. Now, you will get some people who go down to the pharmacy and pay for a vaccine, then they'll come into you at the practice and wanting their free vaccine for over 65s. So it's not a recommendation that you follow it up with a second free one. You could probably just leave them be unless they insist. You've got nowhere to go. So the FluAd Quad, so FluAd, ad is the adjuvant, the extra adjuvant. So that's a really important one to remember and commit to memory, that you don't give that to anyone under 65. And the Alfuria Quad, you don't give that to anyone under 5 years of age. So they're really important things to realize and to know so that you don't make a drug error when you're getting these vaccines out of the fridge. Now, another schema for the same information is from New South Wales Health, and this is taken from the toolkit. So this is really useful. Now, this has only got the funded vaccines on it, yeah? And you can see none of these vaccines, all the red crosses there, we give to kids under 6 months of age. Now, for younger children, 6 months to 5 years, the only ones that are free and funded are the Fluarex Tetra and the Vaxigrip Tetra. Now, for children who are 9 years of age and under, the first year they have influenza vaccine, we give 2 doses at least a month apart. 2 doses at least a month apart for children under 9 years of age. If they've had influenza vaccine in the past, we just give them a single dose this year when they front up. And you can see over here in the green, the only free and funded vaccine for people over 65 is the FluAd Quad. But you can see ticks here for 65. They can have the other vaccines, people over 65, no drama. They're just not funded for them. They'd have to pay for them at the retail pharmacy. So the timing of the vaccine, so timing this year is really tricky with the COVID vaccines. But at the moment, obviously everyone under 50, unless they're a 1A worker and getting a Pfizer vaccine in the hospital, is the AstraZeneca COVID vaccines, not recommended for anyone under 50. So if you've got COVID vaccine at your practice, you're not giving it to anyone under 50. Obviously those people can come in and have an influenza vaccine. Now, there's no data on giving COVID vaccines and influenza vaccines at the same time. So the advice is to separate them by at least 14 days. Separate them by at least 14 days. I'll just go back to that slide. No, I just lost that slide. Getting back. There we are. Yeah, so separate them by at least 14 days. Now, you can give that 14 days can be before or after the COVID vaccine. So in general, if people are having if they're a 1A worker and they're getting COVID vaccine at the moment, you'd probably let them have their 2 COVID vaccines, and then at least 14 days after dose 2, you can give them their influenza vaccine. For people who are waiting for a vaccine later in the year, so people under 50, for example, you'd be better off to give them their influenza vaccine now, and then they'll be able to have their COVID vaccine later in the year without any interruption. Now, it's a busy year for everyone in general practice and in public health, and we do like to be able to answer the phone and answer your questions and help you with catch-ups and whatever questions you've got, but our capacity to do that is a little bit curtailed at the moment. So we do have a really good website that's got really good guidance for catch-up for kids who are behind on their regular scheduled immunisations. We've also got really good information there about influenza vaccine. All the to-the-point newsletters are there, and links to the other webinars that we've done with the PHN. So that's a great source of information. The first website I had up, the New South Wales Health website on immunisation, also has some wonderful immunisation information. So do search for information yourself. If you do need to, then please give us a ring, but try to search for the information yourself as well. And I'll leave it there and hand over to John. And I don't know, Jenny, we're doing questions at the end, I guess?
We are, Patrick. We'll do questions at the end.
Great. All right, I'll leave it with you. Thanks, John.
Thanks, Patrick. And we might get Casey now.
Hi, John. Thank you. I thought I was going last, so thanks for that, Patty. That was fantastic as usual. And now here's your next favourites coming up. It's me and then John. So just in regards to, sorry, Jen. So in regards to immunisation and community of practice, if you, I'm sorry, I put the wrong email up. If you haven't already, you can still join the Quality Improvement Community of Practice. Up until the 30th of June, you can email Kate to access that. It's a great place where you'll be able to find and share ideas and resources that will help to support your quality improvement activities. But also, if there's any QI activities you'd like assistance with, please contact your PCIO and we'd be more than happy to help you with that. And have you done a great QI activity around immunisation that you'd like to share your resources to me? My email is kwisemantle@thepHN.com.au. So that would be really great, and we'll get a really good immunisation community of practice happening there. So I just wanted to, I won't keep you guys long at all, just on to the next slide. So if you've done the annual cold chain audit that we did a bit of work with the PHU around, or if you'd like to get started on your audit, just email your PCIO. We can send you a little cold chain check-in that's got some resources to help you along the way. And we've got an example of the cold chain audit PDSA cycles that you can use, and they're on the community of practice. So the next slide, they're just the PDSAs that we did around that. So we'd love to share them with you, so please join. And then the next slide, Jen, I'm just zipping through them as usual. So Ross, one of my fellow PCIOs in the Hunter team, he's also prepared a model of improvement that's available on the community practice. It's in regards to preparing your practice for the COVID-19 vaccine implementation. It's really comprehensive, so I encourage you to take a look at that one. And just the last slide, along with mentioning the cold chain audit again, because we do know how important that is. Idea 2 was regarding the mandatory COVID-19 vaccine training that all your staff have done. So if you're claiming the QI PIP, don't forget to let us know your quarterly QI activities that you've been working on. And if you're stuck, like I said earlier, please don't hesitate to get in touch with your PCIO. Which is the team that I'm a part of, and we'd be more than happy to assist you. So thank you. That's it from me.
Thanks, Casey. Can I just remind you, if you've got questions, if you want to pop them in the questions area, and we'll endeavour to answer those towards the end. Just wanted to give you a little bit of an update on the COVID-19 vaccine program or vaccination program. As most, if not all of you would be aware, the National Cabinet met on the 19th and 22nd of April and discussed the potential recalibration of the COVID-19 vaccination program. They agreed to a series of changes to our program, and those changes included bringing forward the commencement of vaccination for Australians 50 years and older. That's currently would have been phase 2A in the normal rollout. That's been brought forward to the commence on the 3rd of May for state and territory and GPRCs, and the 17th of May for general practice. And I'll just come back to that in a minute. The other thing that the National Cabinet agreed to was the recommendation to limit the use of AstraZeneca for people 50 years and over, and also to limit the use, as a consequence, limit the use of Pfizer vaccine to those 50 years and under. That includes aged care, disability residents and workers, and also the healthcare workers that Patrick spoke about earlier. There will be a progressive expansion of the state-run Pfizer clinics to ensure that there are opportunities for those under 50 to have access to the Pfizer vaccine as soon as additional supplies are made available. So just wanted to talk about the issue of the availability of vaccine and dispel some myths. Firstly, the availability of vaccine is and remains quite limited. The CSL facility in Melbourne is producing vaccine as quickly as it can. However, that is not able to meet the demand that we have in the community at the moment. It's likely that some of the AstraZeneca vaccine that was allocated to the states and territories will be redistributed to primary care in the near future, and the Commonwealth are working through that now with both the states, territories and the CSL provider. Also want to just state that the PHN does not determine the distribution of vaccine. That's done by the Commonwealth. We play no part in working out how many or the volume of vaccine that you get. That's entirely done by the Department of Health in Canberra. So, you know, happy to receive your request, but we can't actually change your vaccine availability at this point in time. On the 17th of May this year, or if you have available stock that is not going to be used for category or cohort 1B, you can request the early commencement of vaccination for people 50 years and older. To do that, simply send a request to vaccine@thephn.com.au. We'll provide you with a response which will confirm your opportunity to give AstraZeneca vaccine to people 50 years and older, provided you continue to, wherever possible, vaccinate those in the 1B cohort. That's the 70 years and over. So this allows you to use vaccine where you have unused supply or where you are having problems filling clinics, which we know is happening in some instances. The other thing just to remind people is that the TGA have updated their advice on COVID vaccine using the AstraZeneca product, and that there is additional advice on the department's website for patients and practitioners to be able to have an informed discussion about that particular product. In the last few weeks, there's been an update to the COVID vaccine training program to reflect the changed advice from ATAGI, the TGA, and the department. So some of the modules that you would have seen early in the piece have been updated to deal with thrombosis and thrombocytopenia syndrome. So there's some additional advice around handling and storage of the vaccine. So I urge you to have another look at that. Probably better now if I go to the questions and try and answer those. So Patrick, you still there?
Yes, John.
So we've got a question here from Simon Holiday, which says, what's the best way to report an adverse reaction? No one will report everything, as about half the recipients have some sort of flu vaccine-like reaction. He says he had a significant non-reaction with one chap presenting day 2 with a swollen calf, I'm assuming. The scan showed no DVT, however, he's been telling all and sundry that he had a clot. He didn't report it as there were no diagnostic problems. I've provided advice around the COVID vaccine. Do you want to just comment on reporting influenza vaccine adverse events?
Yeah, fantastic. Thanks, John. Yeah, good question, Simon, and well done checking out that clot. Obviously, with the COVID vaccine, we're very alert to any clotting issues, any thrombus, looking for TTS and VIPIT presentations. So they're really important to pick up, and you report them directly to us at the PHU, and the same with influenza vaccine. Report them to us at the PHU. Now, people do get side effects the day after COVID vaccines and influenza vaccines, headaches, flu-like illness, a bit of fever, a lot of aches and pains, and some younger people who have stronger immune systems have quite a strong reaction to both the vaccines that we're currently using, and so that's an expected reaction. So if you read the product information, if you look at the phase 3 trial information, the company said that people are going to have these effects, and they do. So you need to, no need to report those, because we know people are going to have those. But it is really important that you report anything out of the ordinary or anything you can't, you're not sure what it is. Report that to us, and we're reporting really regularly to the TGA, and that we've got lots and lots of systems at the moment for looking at adverse events and examining them. So anyone that gets admitted to hospital anywhere in New South Wales and they've had a vaccine in the last week or two, we follow up those cases and get all the clinical details and examine them very closely to see whether the vaccines had any role. We really want the whole process to be very transparent and for the public to have complete confidence in our ability to find any problems after these vaccines. So often after vaccines, we're debunking false science sort of things like the autism MMR thing, but the thrombus effects after the AstraZeneca vaccine is extremely rare, but it is a real adverse event. So we really want to find those and report them on. So do be alert for any persistent ongoing headaches or any signs of any thrombus in the gut or with a PE, and like you did, rule out any DVTs in the legs. But yeah, so if you've ruled that out, you think it's a normal reaction, there's no need to report it. If it's anything untoward, anything you're not certain of, then please report it to us at the PHU. And the national reporting form, used the same for all vaccines, is on our website. Thanks, John.
Thanks, Patrick. Thanks for that answer. That's good. So we've got a question about the use of the AstraZeneca vaccine in under 50s that qualify for phase 1B. So what I'd suggest you do is have a look at the department's website and the ATAGI advice on the use of COVID-19 AstraZeneca vaccine. And what it does say, and I'll read it to you now, is the COVID-19 AstraZeneca vaccine can be used in adults aged under 50 where the benefits clearly outweigh the risk for that individual and the person has made an informed decision based on an understanding of the risks and the benefits. And I'll post a link to that advice in the chat box now, Eleanor. So you should be able to see that now. The next question is, where is the Pfizer vaccine available in Hunter, New England for health professionals under the age of 50? So I'm going to probably answer that in two ways. The first one is the local health district are responsible for vaccination of their health workforce, and that vaccine program is run through the local health district. At the moment, for primary care health professionals under 50, the logistics of getting the vaccine out to people in that category across our region is still being worked out. And we're expecting some advice in the next week about both the location and the availability of the Pfizer vaccine for primary care workforce in our footprint. So we'll put that in our bulletin and get that out to you as soon as we can. I hope that answers that question. Are there any more questions? I think we've answered all of them that are in the chat at the moment. Jenny, unless there's any more questions, I think we'll hand back to you and call it time.
Thanks, John. Thanks everybody for coming tonight. And just remember that we have an education calendar on our website where you can see all the education that we have coming up. We are doing a few face-to-face events now, which is very exciting, but still lots of webinars. So thank you very much to our presenters. Thank you, Patrick and Casey and John. And I'll catch you at our next education event. Thanks, everybody.
Thanks, Jenny. Thanks for organising this. Appreciate it.
Thanks, everyone.